Did you know there's a silent disruptor affecting countless women, often without them even realizing? In today's video, we're diving deep into the world of inflammation, a hidden force that can impact every facet of our well-being. We'll uncover its subtle effects on women's health and arm you with practical strategies to combat it. So if you care about your health, and I know you do, you won't want to miss this. Welcome back to my channel. I'm Dr. Renee. I help women balance their hormones naturally. And before we get into it, a little disclaimer, the videos on this channel are for informational and educational purposes only. They are not to be taken as professional medical advice. While I am a doctor, I am not your doctor. So do me a huge favor. If you have a health concern or medical need, please consult your own personal doctor or healthcare practitioner. Okay, with that out of the way, let's get into it. So what exactly is inflammation? You know, we hear this word thrown around all the time, but do you know what it is? Well, let me help you out. It's your body's own alarm system. It's a natural response to things like injury or infection, but sometimes the system goes into overdrive, which can lead to chronic inflammation. Now, chronic inflammation isn't just about swelling or redness. It can be a silent saboteur playing a pivotal role in various health issues many women face. Did you know that inflammation can impact women differently than men? From hormonal imbalances to autoimmune disorders, its effects on women's health are profound and far-reaching. But there is good news. There are practical and effective ways to combat inflammation. And no, it doesn't always require drastic lifestyle changes. Sometimes it's small everyday choices that make the biggest difference. So what exactly is the difference between acute inflammation and chronic inflammation? Well, acute inflammation is a short-term response, typically after an injury, like a cut or an infection by bacteria or viruses. It starts rapidly, usually within minutes or hours, and symptoms can be severe, but often only last for a few days. Examples include things like a sprained ankle, a sore throat, or a cut in your skin. The process involves increased blood flow, which is the redness, accumulation of white blood cells, which is the swelling, and swelling is also due to the release of substances like cytokines and histamines, which are there to not only fight infection, but promote healing. This type of inflammation is crucial as it helps the body heal and protect itself. So now let's talk about chronic inflammation, which is different than acute inflammation. It's slower, less obvious, and more prolonged, and can last anywhere from months to even years. It often starts with the same mechanisms as acute inflammation, but instead of resolving, it persists. This long-term inflammation can result from persistent irritants, such as an autoimmune response, where the body attacks its own tissues. It can develop after prolonged exposure to toxins or chronic diseases like undetected low-grade infections. Unlike acute inflammation, which is beneficial, chronic inflammation can lead to various diseases like cancer, heart disease, diabetes, and arthritis, to name a few. It's more subtle and can exist without noticeable changes, often detected through blood tests or when it triggers a more apparent condition. So what causes chronic inflammation? Number one, poor dietary choices. Regular consumption of processed foods, trans fats, and high sugar intake can lead to chronic inflammation. These types of food can disrupt the natural balance of gut bacteria, leading to gut inflammation and provoke a constant low-level immune response. And over time, it can set the stage for chronic inflammatory diseases. Number two, persistent stress. Long-term stress is more than just mental strain. It physically alters your body. Chronic stress leads to the constant release of the stress hormone cortisol, which, when persistently elevated, can promote inflammation. This type of systemic inflammation can affect overall health and contribute to various chronic diseases. Number three, insufficient sleep. Quality sleep is critical for health. Lack of sleep or poor quality sleep disrupts the body's natural rhythms and can lead to increased inflammatory markers in the body. This is because sleep helps regulate the immune response, and without sufficient rest, the body's inflammatory processes can become dysregulated. Number four, exposure to environmental toxins. Everyday exposure to pollutants like cigarette smoke, industrial chemicals, or even certain household cleaning products can cause a chronic inflammatory response. These toxins can trigger the immune system, leading to persistent inflammation as the body attempts to fend off these perceived threats. Number five, a sedentary lifestyle. Physical inactivity is another key contributor to chronic inflammation. Regular exercise helps reduce inflammatory markers, but a sedentary lifestyle can lead to increased levels of inflammation. Even moderate physical activity has been shown to have anti-inflammatory effects. Hey, if you're enjoying this video, be sure to hit the like button so I know you resonate with the content. Do not forget to subscribe and consider sharing it with someone who is having weird symptoms but just can't pinpoint the cause. This video may give them some insight into the cause of their symptoms. So, what kind of impact does chronic inflammation have on women's health? Number one, hormone imbalance. Chronic inflammation can disrupt the delicate balance of hormones in a woman's body. Hormones like estrogen and progesterone are sensitive to inflammatory responses. When inflammation is present, it can interfere with hormone production, hormone regulation, and function, leading to a range of symptoms and health issues. This can manifest in menstrual irregularities, fertility problems, mood swings, and worsened premenstrual syndrome. Number two, increased susceptibility to autoimmune diseases. Women are more susceptible to autoimmune diseases, which occur when the immune system mistakenly attacks the body's own tissues. This heightened risk is closely linked to inflammation. Diseases such as rheumatoid arthritis, lupus, and multiple sclerosis are more common in women and are associated with chronic inflammatory processes. The exact reasons for the increased susceptibility are complex, but are thought to involve both hormonal and genetic factors. And then conditions that are exclusive or more prevalent in women can be significantly impacted by chronic inflammation. For instance, PCOS, polycystic ovarian syndrome. Inflammation plays a role in the pathophysiology of PCOS, making symptoms worse like irregular menstrual cycles and insulin resistance. Endometriosis, this painful condition where tissue similar to the lining of the uterus grows outside of the uterus, is fueled by inflammatory processes, worsening symptoms and pain. Thyroid disorders. Women are more prone to thyroid disorders, many of which are autoimmune in nature. Inflammation can exacerbate these conditions, affecting overall thyroid function. And menopausal symptoms. Inflammation can intensify common menopausal symptoms such as hot flashes, night sweats, and mood swings. The drop in estrogen during menopause can also contribute to an increase in inflammatory responses. If you want to take a more holistic approach to your health, be sure to come find me on social media. I'm at Dr. Renee Wallenstein on all platforms. So what can you do to prevent chronic inflammation or reduce it if you already have it? Number one, diet. First line of defense against inflammation. Incorporate anti-inflammatory foods. Boosting your diet with foods that are high in omega-3 fatty acids like salmon, mackerel, and flax seeds can benefit. Adding a rainbow of fruits and vegetables, especially berries, leafy greens, and cruciferous veggies like broccoli and Brussels sprouts, can also be beneficial, as well as spices like turmeric and ginger and beverages like green tea. They are all potent anti-inflammatory foods. Limit inflammatory foods. Stay clear of processed foods, refined sugars, and trans fats, which trigger inflammation. Be mindful of your caffeine intake and opt for healthier cooking oils like avocado oil and olive oil. Then we have lifestyle choices. Regular exercise. Physical activity is not just good to your muscles. It's also a powerful inflammation fighter. Aim for a mix of cardio, strength training, and flexibility exercises. Quality sleep. Never underestimate the power of a good night's sleep. Proper rest helps regulate stress hormones and keeps inflammation in check. Stay hydrated. Drinking enough water is essential for overall health and helps in reducing inflammation. Manage stress. Chronic stress is a key contributor to inflammation. Mindfulness techniques, breathing exercises, and regular meditation can be effective tools to reduce stress. And positive social connections. Cultivating strong, positive relationships can have a profound impact on your mental and your physical health. And last but not least, reduce toxin exposure. First and foremost, personal care products. Choose non-toxic skincare and beauty products to reduce your exposure to harmful chemicals. Plastics. Where possible, replace plastic containers with glass or stainless steel to avoid chemicals leaching into your food and beverages. Food choices. When possible, opt for organic foods, especially those listed in the Environmental Working Group's Dirty Dozen. Water, as well as your environment. Consider using water filtration systems and air purifiers to minimize exposure to pollutants in your home. And if you enjoyed this video and want to learn more about functional medicine, check out one of my recent videos where I talked about the difference between conventional medicine and functional medicine. And with that, we'll see you right back here next week. Ciao.